All right, in the last lesson, we introduced some aspects of Australia's health system, particularly things around the public health system. So we looked at Medicare, the Pharmaceutical Benefits Scheme, and the National Disability Insurance Scheme. And what we're going to look at today is the private health system, and then also these ideas of how we relate funding, sustainability, access and equity to Australia's healthcare system. Again, that's just a little recap of the healthcare system. We've got these kind of public, government-funded things that are available either to everyone or to people that need it, for example, the NDIS. And now we're going to look at these private services. So private health insurance is an optional form of health insurance that people can choose to purchase. So it's available as well as Medicare. So remember, everyone in Australia can access Medicare, and then private health insurance is an optional thing that people can buy on top of that. When you get private health insurance, it's usually by an individual, but it could also be obviously families. Or often companies might purchase this for their employees. But you pay a fee, which is usually either every month or every year, through a private company. And you've probably recognised some of these symbols from ads or from adverts in magazines. You might have seen some of their buildings around the place. These are private health insurance companies. And I think an important thing to note is that generally, these companies don't own hospitals or own clinics or employ GPs. They are a company where you pay them money and then they pay money to the health services. With private health insurance, there are different levels of cover. So you see this word cover is usually the word used to describe insurance. So you can purchase a different level of cover depending on your need, but also depending on your budget. So often if you are young and healthy and single and don't have children, generally that price might be a bit lower than someone that is older or has a lot of health conditions or maybe is thinking about starting a family, because those things cost a lot of money in terms of healthcare. Some of the things that are included in private health insurance are obviously private hospitals is a big reason a lot of people choose to buy this. And often there are hospitals that only allow private patients. So some hospitals will not accept public patients, only private patients. And they do tend to have nicer facilities and better food, and they feel a bit more homely and comfortable than a public hospital. They usually include ambulance. Remember, ambulance cover is not included with Medicare. Another big plus of private health insurance is getting to choose the doctor that you see in hospital. Remember, with Medicare, you can choose your GP, but if you go to hospital, you see whichever doctor is there. In private health insurance, you get that choice, unless, of course, it's an emergency, you'll see whoever is available. But if you're booking in to see a specialist, you can choose who you see. Another really big plus is the allied health services. So remember, these are not generally covered with Medicare. So things like physiotherapy, occupational therapy, things like massage, speech therapy, chiropractic, they are included. And often you can choose which ones you want. So you might have a lot of physical problems, or you do a lot of sport. So you might say, I want physio, chiro and massage, but I don't really need speech therapy. And that will change the price that you pay. And dental cover is another really big plus of private health insurance, as most dental cover is a private fee. It's not covered in Medicare. Private health insurance funding comes mostly from the people that pay for it. So the people that purchase private health insurance, but there's also some support given from the government. Okay, so remember, the government the federal government pays for Medicare and for public hospitals. They also give some money to private health insurance companies as well. And there are some incentives, or I guess kind of things that are there to encourage people to buy private health insurance. One of those is what's called the private health insurance rebate. So a rebate basically is when you are given money back for something. And in private health insurance, that is where the government pays a portion of the fee. So let's say an insurance premium was $100 a month. Depending on what your income is, the government might pay 30% of that, which would be $30. So you pay $70. Okay, that is to encourage people to have private health insurance. There's another incentive called the lifetime health cover, and that is basically an incentive for buying health insurance before the age of 31. So if you buy health insurance before the age of 31, the fee you pay kind of stays the same every year. If you buy it after that age, you pay an extra 2 to 3% every year. And that relates to as people get older, generally their need for healthcare increases. So it's encouraging people to buy this insurance early. And there's also the Medicare levy surcharge, which we discussed in the last lesson, is where a lot of the money for Medicare comes from. It comes out of tax. People pay a percentage of their tax in the Medicare levy surcharge. If you have private health insurance, you don't have to pay that fee in your tax. And depending on how much money you earn, the Medicare levy surcharge is often around about the same as the private health insurance cost. Okay, so if you're earning, say, $80,000 a year, which in Australia is considered, a reasonably high income, the idea behind this is if you're earning that much money, you can afford to buy private health insurance. And if you're buying private health insurance, you're not having to use Medicare and those public services as much. So if you choose not to buy it, then the government is kind of taxing you the same amount of money anyway. So you're paying that money, but you don't have private health insurance. So really it's about encouraging people to buy private health insurance because it relieves the pressure on the public health system. Okay, so when you've got those notes written down, just jump in to question 1, just around what private health insurance is and what it covers and how it's funded. Okay, and same as with Medicare, there are advantages and disadvantages of private health. And most of these are around the individual, but there's some that more look at it as a system. So, obvious advantages. You get access to private hospitals, you can choose your doctor. There's usually reduced waiting times for treatment and surgery. With Medicare, if you have something urgent, you will be seen straight away. But I used the example last time, let's say you're playing sport and you rupture a ligament in your knee. Because it's not going to kill you if you don't have that fixed, you might go on a waiting list. It might take you 6 months to see a doctor through the public system. If you have private health, you might see a doctor the next day. Okay, so you're kind of paying for that faster treatment. It covers those extras, like we talked about, physio, dental, massage, there's a whole range of things. I guess this is more looking at it as a systemic thing. Having this system reduces the cost of Medicare and the public health system. Okay, and we'll come back to this later in the lesson, but it basically is reducing that burden on the public health system. And another advantage is those kind of financial incentives, especially for people earning more money. If you're earning more money, it makes sense to have private health insurance because you'll pay pretty much the same amount in tax anyway. There are a few disadvantages. It can be quite expensive. Depending on the level of cover, it can cost quite a lot of money for individuals, and especially if you have health conditions already. Insurance companies often either won't cover you for something that you already have. Or if they do, you pay a much higher fee, because their thinking behind that is, well, if you've already got this heart problem, then we know you're going to need lots of treatment and we're going to have to pay for that, so you need to pay more money. There is sometimes still a gap fee that needs to be paid. So the private health insurance might cover, say, $200 of an appointment fee, but you might still have to pay an additional $100. There's often what's called an exclusion period, and this basically means a period of time where you can't make a claim for certain things. So an example would be, let's say I signed up for private health insurance today, and I chose a policy that includes everything, including maternal care. It might say in my policy that I can't access any services for maternal care for 12 months. Okay, so often there's a period that you have to wait before you can access that. So you generally have to buy this in advance, not kind of, when you decide you need healthcare. Okay, so it takes a bit of time for things to kick in. And I guess the last one is that it doesn't really promote equality. If you think about the fact that it is a private service, that means that a lot of people cannot afford this. And if we're looking at things like, social justice and equity and equality, and whether everyone gets equal access to things, that's not the case with private health. If you can't afford it, you generally can't buy it. So you have things like the waiting list for Medicare. You don't have the optional extras such as physio, all of those kind of things. Okay, so jump into question 2, and I just want you to actually discuss a few of those. Don't just list them, kind of explain them, why they're an advantage, why they're a disadvantage. Okay, the final part of this dot point is looking at these 4 areas in relation to Australia's healthcare system. So just note with this, we're looking at the whole system, so public and private. So what you looked at on Wednesday as well as today's. Okay, so we're going to have a quick look at funding, so where the money comes from for our healthcare system, sustainability, access, and equity. So just make sure you do have notes on each of these. Okay, so firstly, funding. We did kind of discuss this when we looked at each of the different services, but funding, if we're looking for our definition, is basically the financial resources that are provided to keep the system going and providing a high quality of care. That's really important. Australia has a good healthcare system, and that's because it's really high quality, and that needs to come from money, obviously. Funding to the healthcare system goes towards a lot of things. So it pays for things like appointments. It pays for building infrastructure, so making hospitals, for example. Training professionals, so doctors, nurses, physios, all of those things, those people are part of our healthcare system and they need to be trained. For purchasing medical supplies, so that could be machines inside hospitals, it could be the protective equipment that doctors wear, it could be medicines, it could be therapy things for people that have had a stroke. All of those things need to be bought. Health promotion programs, which we've started looking at and we're going to come back to, they cost a lot of money. And also a really big one is research and development. I think you could link that really well back to this idea of high quality of care. We didn't just stop in 1928 and go, oh, great, antibiotics. We don't need to do any more research and development because healthcare is sorted. Healthcare is changing all the time, and that is because of scientific research, developing new medicines, developing new treatments, new types of surgery. Okay, so all of that is paid for through our healthcare system. And the funding comes from a range of places. We've talked about the government, so the federal and state governments pay a lot of money to things like Medicare, the NDIS, building hospitals, all of that. And then we've got our private bits as well. So when you pay to individuals, that could be through obviously tax, or it could be through private health insurance, and the same with businesses. Okay, so it's funded publicly and privately. Okay, so just jump into question 3 and discuss that. Okay, sustainability. Remember, we looked at sustainability earlier in Unit 3, looking at this idea of resources being available into the future. And that it's the same thing, really, if we think about healthcare. With a sustainable healthcare system, basically provides a workforce and infrastructure into the future. Okay, so we don't build a hospital that's only going to last for 2 years, for example. When healthcare systems are designed, they need to be sustainable. That might mean building a hospital in a new area where no one lives there yet, acknowledging that 10 years down the track, a lot of people are going to live there. Or having enough beds that, let's say, for example, coronavirus happens and all of a sudden we need a lot more treatment capacity. Okay, training enough doctors and nurses. Obviously it takes a really long time to train as a doctor. You can't just say, oh, we need 10,000 more doctors, let's get them now. That needs to be planned. Okay, and also I want you to think about things like, how does funding, or the way the healthcare system is funded, make it sustainable? There are 4 kind of key requirements for a sustainable healthcare system. So the first one is that there is adequate funding and regulation. So obviously there needs to be money available every year to support this healthcare system. You don't just spend millions of dollars building a hospital and then you never have to spend money on it again. There needs to be money available to keep it running, to keep it clean, to keep it modern, all of those things. Same as hiring staff. You need to have that money coming in every year. Having an efficient health system and workforce. So this is making sure you have the right people, you have enough of those people, and that they're doing their job in an efficient way. So for example, how many patients can one doctor see? Obviously it makes sense. If you've ever been in hospital, you probably see that doctors do the rounds. They might go to 4 wards and see 100 patients in a day. That is much more efficient than having one doctor seeing 10 patients, because that's going to cost a lot more money. Another really important thing for a sustainable health system is being able to prevent disease or treat diseases early. Think back to health promotion. The whole purpose of health promotion is to stop people getting diseases in the first place. We know that saves huge amounts of money, and if we're looking at sustainability, we want to stop people getting sick because it's going to cost less money in the long run. Okay, so you need to spend that money on preventing disease to support a sustainable healthcare system. And the last one is that kind of research and development that was mentioned in the last slide as well. Again, it's about efficiency. If you develop a new drug that is maybe much cheaper than what we currently have, that means more people can access it and it costs less money. If there's a new type of surgery that only takes an hour instead of 10 hours, that means more people can have that. Okay, so these are all about ways to make sure that the healthcare system can continue to provide high quality care for years and years and years. Okay, so just jump in and answer question 4. Okay, access. Here we're talking about the ability of people to access quality health services based on their need. Okay, and that's a really important one. Not on their ability to pay, but based on who needs that service. Access in Australia's healthcare system is promoted in quite a few different ways. The first is obviously Medicare. Medicare is our universal healthcare system that everyone is entitled to. And this idea of bulk billing, that is certain clinics will only charge what the Medicare fee is. So that would mean that people with a low income, don't pay any gap fee at all. So they can always see a doctor and not have to pay any money. The pharmaceutical benefit scheme. Okay, so remember that covers the cost of the majority of the cost of medications. Okay, so people can access medication when they need it. This is a really important thing in Australia. In the US, where they don't have a system like the pharmaceutical benefit scheme, some medications literally cost thousands of dollars, and a lot of people can't afford them. A lot of people die because they cannot afford the medication that they need to treat their condition. The NDIS, National Disability Insurance Scheme. Remember, talking about based on need. Okay, I'm not eligible for the NDIS because I don't have a disability. Okay, it is there for people that need it, and it doesn't matter whether or not they can pay for it, they get it. It's quite a new scheme that didn't exist for a very long time in Australia. There's also a lot of specialist services, especially in rural areas in Australia, so kind of regional health clinics, and things like the Flying Doctors Service. Okay, so talking about access and people needing to be able to access healthcare, if you're living in a really regional or remote area, that might mean having to be flown to the city to see a specialist. Or sometimes specialists might fly out once a month to regional areas to see people. And another big one, and we'll come back to this in a week or two, is culturally appropriate services, especially Indigenous health services. So we've looked a lot at access, not just being a physical thing, but also a kind of socio-cultural thing. Can people access the information? Is it appropriate to their needs? Is it in language that they understand? Okay, so these are all ways that Australia's healthcare system promotes access for everyone. Okay, so just answer question 5. Okay, and the final one is equity. And this is basically referring to the way that the health system recognises and responds to people based on their needs. And I think a good way to think of that is that those who need more receive more. Okay, in our healthcare system, that's evident in a lot of ways. One is that Medicare safety net that we discussed on Wednesday. So that is where, let's say, once you spend $1,000 in a year through Medicare, then you stop paying money. Even if you keep having to go access specialists and paying those gap fees, if you've got a chronic health condition and you have to spend a lot of money on healthcare, there's a maximum that you have to spend. Mental health care plans. These are, psychology is not generally covered in Medicare except through a mental health care plan through a GP. So this is where people who need a bit of support from a psychologist receive it. So not everyone gets that. It's about those who need it. Also, just on that note with mental health care plans, if you are struggling with depression or anxiety or anything like that, please go see your GP and get one of those plans. They're really fantastic. It gives you access to 10 sessions a year with a psychologist. And the whole idea is, we talked about that prevention, that we identify these issues early and give people support they need so that things don't get worse over time. Okay, so please go see a GP if you think that is something that could be useful to you. Concession payments for the pharmaceutical benefit scheme. So remember, if you have a healthcare card, you only pay $6.50 for the medications as opposed to around $40. Okay, so people who have less money pay less money. It's about equity. Individualized NDIS plans. So the NDIS itself promotes equity because only people with a significant and permanent disability are eligible. But then even within that, it acknowledges that not every disability is the same. Some people might just need a little bit of support. Some people might need huge amounts of support. So the plan and the money they receive is individualized. And also there are some public dental health services. It's quite rare, but usually for children, there are some dental health services. Plus for people in certain risk categories, they might be eligible to that for that. So again, it's about this idea of people who need more receiving more. Okay, if you go back into the doc, there's a couple of questions to finish off there, but that kind of covers everything in this dot point on Australia's healthcare system. And when we're back next week, which is very exciting, we'll go back to looking at a few health promotion programs, particularly in areas around smoking, Indigenous health and nutrition.